Next-Gen NCLEX NGN. Practice questions, answers and rationales included. Question 1. A middle-aged adult client is admitted to the hospital for hematuria. The client has no previous history of illness, is married, and has 3 children in high school. Which task of middle adulthood is most likely to be disturbed? Option A. Assisting the children grow into adulthood. Option B. Coping with a role transition. Option C. Renewing earlier relationships. Option D. Developing adult leisure time activities. The correct answer is option A. Assisting the children grow into adulthood. According to developmental theorists, the primary task of middle-aged adults is generativity, specifically, guiding, providing for, and assisting the next generation. Question 2. The nurse prepares to insert a Foley catheter into the client. It is most important for the nurse to take which action? Option A. Place all supplies close to the edge of the table. Option B. Keep the field holding the supplies in front of the nurse. Option C. Set up the field below the nurse's waist level. Option D. Add only clean supplies to the field. The correct answer is option B. Keep the field holding the supplies in front of the nurse. A sterile field must always remain in direct, continuous line of sight. Turning away or dropping hands below the waist instantly breaks the strict rules of sterility. Question 3. The nurse does discharge teaching with a client that has a new diagnosis of eczema. Which common foods are likely contributing factors of eczema that the client should eliminate in the diet? Option A. Fish, nuts, and chocolate. Option B. Strawberries, tomatoes, and apples. Option C. Milk, wheat, and egg whites. Option D. Soybeans, orange juice, and egg yolks. The correct answer is option C. Milk, wheat, and egg whites. Cow's milk, wheat gluten, and egg whites are the most highly allergenic dietary proteins globally and are infamous for triggering severe eczema flare-ups. Question 4. The clinic nurse interviews a middle-aged adult client who reports difficulty sleeping and ongoing fatigue. The nurse learns the client frequently works the night shift. Which is the best initial statement for the nurse to make? Option A. Tell me about your usual sleeping habits. Option B. You probably sleep when you can during your night tour. Option C. This is normal for your age group. Option D. Working the night shift is known to disrupt sleep patterns. The correct answer is option A. Tell me about your usual sleeping habits. An open-ended assessment statement gathers vital, patient-specific data without making assumptions, which is the required first step of the nursing process. Question 5. When witnessing a client's signature during informed consent, it is most important for the nurse to make which assessment? Option A. Does the client understand the procedure? Option B. Does the client have any questions? Option C. Does the client give consent voluntarily? Option D. Is the client able to write their name? The correct answer is option C. Does the client give consent voluntarily? The nurse's legal signature purely attests that the patient is the person signing and that they are doing so freely, without any coercion or heavy sedation. Question 6. The morning before surgery, a client signs an operative consent form. Soon afterward, the client calls the nurse and states they do not want the surgery. Which action does the nurse take first? Option A. Notifies the healthcare provider of the client's decision. Option B. Informs the client the decision has delayed the operating room schedule. Option C. Encourages the client to discuss reasons for canceling the surgery. Option D. Asks the client's family to encourage the client to have the surgery. The correct answer is option C. Encourages the client to discuss reasons for canceling the surgery. Patients have an absolute right to withdraw consent at any time. The nurse must first therapeutically explore the patient's fears or concerns before escalating. Question 7. The nurse identifies which change in the pattern of urinary elimination is usually associated with client aging. Option A, decreased frequency. Option B, incontinence. Option C, sphincter reflex is decreased. Option D, a formation of bladder calculi. The correct answer is option C. Sphincter reflex is decreased. As humans age, the smooth muscle tone and neurological reflex of the urinary sphincter naturally weaken, decreasing the ability to forcefully hold urine. Question 8. While a client is being treated for a wound infection, it is most important for the nurse to routinely perform which action? Option A, check and record the client's temperature. Option B, send samples of wound drainage for culture. Option C, assess the perfusion in the area. Option D, evaluate the results of the blood culture. The correct answer is option A. Check and record the client's temperature. A rising core body temperature is the most rapid, direct physiological indicator that a localized wound infection has breached the bloodstream and is turning systemic. Question 9. The nurse assesses an older adult client. Which statement does the nurse expect the client to make? Option A. I seem to get fewer upper respiratory infections than I did before. Option B. I think that I am a little taller than I used to be. Option C. Eating just does not appeal to me anymore. Option D. I have been sleeping with fewer blankets lately. The correct answer is option C. Eating just does not appeal to me anymore. Aging naturally blunts the olfactory and gustatory nerves, causing food to lose its taste and smell, frequently resulting in a severe loss of appetite. Question 10. The nurse knows that serum albumin is used as an indicator of malnutrition for which reason? Option A. Albumin from eggs is commonly ingested and constant in the diet. Option B. Albumin is the first result on a protein electrophoresis. Option C. Serum albumin is easy to measure and can indicate a protein deficiency. Option D. Serum albumin has a short half-life, making it an easy protein to measure. The correct answer is option C. Serum albumin is easy to measure and can indicate a protein deficiency. Serum albumin is a massive plasma protein manufactured by the liver. Chronically low levels are the cheapest, easiest, and most reliable blood indicator of prolonged malnutrition. Question 11. Which nursing action does the nurse have to establish first when caring for a client in pain? Option A. Teach the client about the pain. Option B. Establish a trusting relationship with the client. Option C. Determine how various relaxation techniques affect the pain. Option D. Administer pharmacological agents. The correct answer is option B. Establish a trusting relationship with the client. Pain is entirely subjective. If a patient does not trust the nurse, they will severely underreport their pain or refuse medication, entirely derailing effective treatment. Question 12. An older adult client asks why they are having constipation. Which rationale does the nurse use regarding the primary reason for constipation for this client? Option A. Older adult clients eat smaller amounts of food with decreased bulk. Option B. Older adult clients have less physical activity and decreased muscle tone. Option C. Older adult clients have neurological changes in the gastrointestinal tract. Option D. Older adult clients have decreased sensation in the gastrointestinal tract. The correct answer is option B. Older adult clients have less physical activity and decreased muscle tone. A sedentary lifestyle combined with naturally weakening abdominal and bowel musculature severely slows down peristalsis, causing chronic constipation in the elderly. Question 13. The nurse explains to the nursing student that a client has a new diagnosis of psoriasis. Which best describes psoriasis? Option A. Chronic autoimmune reaction. Option B. Acute infectious disease. Option C. Viral disease. Option D. Cystic, self-limiting disease. The correct answer is option A. Chronic autoimmune reaction. Psoriasis is a non-contagious, chronic autoimmune disease that hyperstimulates the skin, causing epidermal cells to rapidly multiply and form thick, silvery plaques. Question 14. Following a total hip arthroplasty, the elderly client is ordered to begin ambulation with a walker. Which statement by the nurse is best? Option A. Sit in a low chair for ease in getting up to use the walker. Option B. Make sure rubber caps are in place on all 4 legs of the walker. Option C. You will begin weight bearing on the affected hip soon. Option D. Practice tying your own shoes before you begin ambulating. The correct answer is option B. Make sure rubber caps are in place on all 4 legs of the walker. Safety is paramount. Without intact rubber caps, a metal walker will instantly slide out from under the patient on a hospital floor, causing a devastating fall.